Hello and welcome back. I am Dr. Ankit Gupta from Panache Aesthetics, Pitampura, New Delhi. I am a plastic surgeon and today's video is on facial fat grafting to face. As you all know, fat is the liquid gold and this is a very in treatment these days. Fat has stem cells and that is very useful. Fat can give you volume, so it can be used as a natural filler. It has stem cells, so it can rejuvenate your skin, it can rejuvenate your tissues, and that is why it is very frequently used these days in various different facial plastic surgical procedures. It could be combined with your facelift, could be used to fill your under the eyes, your dark circles. It could be used as a filler in your lip, could be done for your nasolabial folds. It could be filled anywhere in your face. So today I'll be explaining you with a patient how we did her facial fat grafting and what all we did. So when I'm talking about fat grafting, fat that we are able to use in your face has to be harvested from some part of your body, and for her we were able to take that fat out from her thigh area, and we took out around 100 ml of fat from her, and this 100 ml of lipoaspirate was separated into fat. We got about 50 ml of pure fat. We used a handheld centrifuge to extract all this fat, and then this fat is prepared into various different types. There are three major kinds of fat that I prepare. One is your milli fat or the thicker fat, which is used mainly to give volume, which is given to the deep areas. If I see my face, if I have to give fat, we could inject that fat into the temporal hollowness. If somebody has these hollowness, fat could be filled up in this area. If somebody has a lot of hollowness in this area, in the medial portion of the upper lid or just in the eyebrow region, this thicker fat could be filled in this area. For somebody who has the cheeks are a bit less, or they have the fat pads have sagged because of aging, we could refill this cheek area with this milli fat. Some amount of fat could be filled near your base of the nose in the piriform region to increase this area and to remove the nasolabial folds. Again, the same fat could be used in very minute quantity in your lips and mainly in your chin area to give you a jawline. So these are the different areas in your face where I could fill this thicker fat. This is to give volume. This is the same fat I would fill up in the breast, I would fill up in the buttock area, and this is the thicker fat that I have used. Now once I have done this, I usually take around 20 to 25 ml of this fat. I usually use it in the upper forehead, in the inner portion to remove the 11s, in the temporal region, some portion in the cheek area, some in the nasolabials, in the piriform region, and some in the cheek and the mandible region, depending from patient to patient. For very few, I would fill up the buccal fat pad if they have a hollowness in the cheek area as well. The second fat is the microfat. The microfat is prepared after breaking down this milli fat into smaller, minute particles. These fat cells are easier to inject into the finer areas of your face where I need a very thin fat layer. This is the fat that I would prefer, and this fat I would prefer to fill in your lip area. This fat I would prefer in the upper portion, in the under eye dark circles. So not exactly the dark circle, but the depressions that many people have in the under eye area, I would prefer to put the micro fat. Similarly, if somebody has these acne scars, I would do a subcision and then put this micro fat in this area. So anything which is superficial, which is not very deep, but I have to give some volume as well, I would prefer to do a micro fat injection. So if there are deep lines in the forehead area, I would again use a microfat. If I need it for the upper eyelid, I would prefer a microfat. So these are the areas I would do a microfat injection. Now coming to the nanofat, and this nanofat is actually the fat which is devoid of any adipose cells. So we break down all the fat cells and all that is left is the stromal vascular fraction or the stem cells or the adipose derived stem cells. These are not actually fat cells, these are the stem cells which can rejuvenate. So it will never give volume, and this is what I would use to fill up each and every portion of the skin of your whole face. I would use this to do the perioral lines, the very fine lines that everybody has around their face with their age. I would like to remove the crow's feet with this nanofat. I would inject this fat everywhere in the face, and this would give glow to your face. This would decrease the fine lines that you have on your face, and over a period of next 2 to 3 months, these would grow and these would provide the stem cells that are required and would rejuvenate your whole face. And the same fat I would use along with microneedling, and I prefer to do microneedling with a Dermapen, and I keep injecting or keep dropping this nanofat on the skin the time when I am doing this microneedling along with a bit of PRP. So PRP is platelet-rich plasma, which is used for vampire facelift. So this fat facial, what I would call, is much superior to the vampire facelift, much superior to PRP facial, and this is used along with PRP to increase the survival of the fat cells, to increase the survival of the adipose-derived stem cells. This is the whole procedure of facial fat grafting, and we can use this fat grafting for various different conditions depending on what you have, and it gives a very good result, and this is the in treatment. So in case you have any doubt doubts, if in case you want to go for this treatment, you can always contact our team, and somebody from our team would be really happy to help you. Thank you and have a nice day.